Gastric Sleeve Surgery. Introduction. Obesity can cause diabetes. Select true or false. Correct. Obesity is the primary risk factor for diabetes. Which of the following body mass indices indicates obesity? Choose one of the following options. 1. BMI of 24. 2. BMI of 29. 3. BMI of 34. Correct. A BMI of 30 or more indicates obesity. Healthcare providers recommend bariatric surgery for patients who are overweight with a BMI of 25 to 30. Select true or false. Correct. A BMI of 25 to 30 is not sufficient to recommend bariatric surgery. The patient has to have a BMI of 35 or more. The advantages of the laparoscopic operation are less discomfort and faster healing. Select true or false. Correct. However, not all patients are eligible for laparoscopic gastric sleeve surgery. Which of the following is true about the gastric sleeve surgery procedure? Choose one of the following options. 1. It makes the stomach smaller. 2. It bypasses the duodenum, where most of the absorption takes place. Correct. Gastric sleeve surgery makes the stomach smaller, which reduces the amount of food that can be stored there. Infections are common during or after gastric sleeve surgery. Select true or false. Correct. Infections are rare. However, they can still happen. Gastric sleeve surgery always produces weight loss that is not gained back. Select true or false. Correct. There are no guarantees that weight loss will be maintained. Success is possible only with the patient's full commitment to changing eating and exercising behavior. Patients will be on a strict diet while healing after the gastric sleeve surgery. Select true or false. Correct. The amount and type of food you eat will be regulated after your surgery. Select true or false. Correct. While healing, the type and amount of food you can eat will be regulated after your surgery. The way you eat will also be regulated. For instance, you should not eat fast or drink fluids with meals. After gastric sleeve surgery, you may need to take a multivitamin and possibly other nutritional supplements for the rest of your life. Select true or false. Correct. Because the amount of food eaten is reduced dramatically, it may not be nutritious enough by itself. The supplemental vitamins and minerals help to avoid a nutritional deficiency. Thank you for using Explain.